Now let's move on to the pectoralis minor along with the clavipectoral fascia with a small discussion of the subclavius muscle. So this topic is very much important for the MCQ part of the examination, and sometimes this clavipectoral fascia and the pectoralis minor can be asked as a short note also. So when we see the pectoralis minor muscle, it is a triangular shaped muscle, and this triangular shaped muscle, it is situated just beneath the pectoralis major. So when we reflect the pectoralis major muscle, we can see the pectoralis minor muscle. And this pectoralis minor muscle, it is also a key muscle because it is going to partition the axillary artery into three parts. The part of the axillary artery above it, it is first part. The part of the axillary artery behind it, it is second part. And the part of the axillary artery below it, it is third part. So this pectoralis minor, it is also a key muscle of the pectoral region. So now let's see the origin of this pectoralis minor muscle. This pectoralis minor muscle, it is going to arise from the third, fourth and the fifth ribs only, not from their costal cartilage. And this muscle is going to insert over this coracoid process. So the fibers, they are passing upward and laterally and going to form one narrow tendon which is going to insert over the upper margin of this coracoid process. So along with the origin from the third, fourth and fifth ribs, this pectoralis minor muscle also get origin from the fascia which covers the external intercostal muscle. As we already discussed, this pectoralis minor muscle, it is a key muscle of the pectoral region because it is going to divide the axillary artery into three parts. So when we draw the axillary artery, the first part of the axillary artery, it is situated above the pectoralis minor muscle. The second part of the axillary artery, it lies behind the pectoralis minor muscle, and the third part of the axillary artery, it lies below the pectoralis minor muscle. The upper border of the pectoralis minor muscle gives attachment to one fascia that is called as a clavipectoral fascia. This clavipectoral fascia, it also encloses one muscle above that is called as a subclavius muscle, which we are going to see shortly. Lower border of the pectoralis minor muscle gives attachment to the suspensory ligament of the axilla, which is nothing but it is the continuation of the clavipectoral fascia after enclosing the pectoralis minor muscle from the both the side. And this suspensory ligament of the axilla is going to continue with the axillary fascia, and this axillary fascia is the continuation of the pectoral fascia. Superior border of the pectoralis minor muscle is accompanied by the superior thoracic artery, and the inferior border of the pectoralis minor muscle is accompanied by lateral thoracic artery. When we see the action of this pectoralis minor muscle, this pectoralis minor muscle is responsible for the protraction of the scapula as the assistant to the serratus anterior muscle. The protraction of the scapula is nothing but it is the pushing movement by the individual, and that will lead to the movement of the scapula as the forward rotation, and this is called as a protraction of scapula. The main muscle for the protraction is the serratus anterior muscle. That's why the serratus anterior, it is also called as a boxer's muscle. But here, this pectoralis minor is assistant to the serratus anterior muscle. One another action of this pectoralis minor muscle is the elevation of the scapula, and this elevation of the scapula is the assistant action of the pectoralis minor muscle along with the levator scapulae and the rhomboideus muscle. So there are two actions of the pectoralis minor. This both the actions, they are assistant to the other major muscle. One is the protraction of scapula, which is assistant to the serratus anterior, and one is the elevation of the scapula, which is assistant to levator scapulae and the rhomboideus muscle. When we see the nerve supply of this pectoralis minor muscle, the pectoralis minor is going to be supplied by lateral pectoral nerve and the medial pectoral nerve. The lateral pectoral nerve, which is going to pierce the clavipectoral fascia and reach up to the pectoralis minor to supply it, while the medial pectoral nerve, it is going to pierce the pectoralis minor muscle and going to supply it. So this is all about the origin, insertion, nerve supply and the action of the pectoralis minor along with the important points. Now let's move on to the clavipectoral fascia and the subclavius muscle. Now a small muscle of the pectoral region, it is the subclavius muscle, and that subclavius muscle, as the name suggests, it is situated below the clavicle. And the subclavius muscle is going to arise from the costo-chondral junction of the first rib, and this muscle is passes on the lateral side and going to insert over the groove, that is subclavian groove, under the middle one third of the under surface of the clavicle. So this muscle is the subclavius muscle. This subclavius muscle is going to be supplied by the nerve to subclavian, which is a branch of the upper trunk of brachial plexus and having root value of C5 and C6. When we see the action of this subclavius muscle, though it is a small muscle, but it is the important muscle to stabilize the clavicle during the movement of the scapula. So now let's move on to the clavipectoral fascia and the importance of it. As we already discussed, the clavipectoral fascia, it is attached from the clavicle to the pectoral region. So above it is attached with the undersurface of the clavicle, and which is going to enclose the subclavius muscle. After enclosing the subclavius muscle, this clavipectoral fascia reaches up to the upper border of the pectoralis minor muscle. Here the pectoralis minor muscle, it is also going to enclose within this clavipectoral fascia, and the lower border of it, the this clavipectoral fascia is forming the suspensory ligament of axilla, which is going to continue with the axillary fascia. So when we take a whole section of it, we can say that suppose this is the clavicle, and the under surface of the clavicle having the subclavian groove, and within the subclavian groove the subclavian muscle is going to get inserted, and the clavipectoral fascia, it is also attached with the both the margin of the subclavian groove and forming the clavipectoral fascia, and then it is going to enclose one more muscle, that is the pectoralis minor muscle. So this muscle is the pectoralis minor muscle. After enclosing the pectoralis minor muscle, this clavipectoral fascia is continued as the suspensory ligament of the axilla, which is going to continue with the axillary fascia. This axillary fascia is nothing but it is continuation of the pectoral fascia, and this pectoral fascia is enclosing the pectoralis major muscle. So this is the proper orientation of the clavipectoral fascia. Now let's move on to the one important thing regarding the clavipectoral fascia, that this clavipectoral fascia, in the uppermost part, it is extend from the coracoid process to the first costal cartilage, and the uppermost portion of this area is thickened, and this thickened portion of the clavipectoral fascia, which extends from the coracoid process to the costal cartilage, it is called as the costo-coracoid ligament. So this costo-coracoid ligament is nothing but is the uppermost part of the clavipectoral fascia, extending from the coracoid process to the first costal cartilage. Sometimes this costo-coracoid ligament can be asked as a short question or the MCQ concern. Now let's move on to the structures piercing the clavipectoral fascia, which are very much important as far as the examination concerned. The first structure which is going to pierce the clavipectoral fascia is the cephalic vein. The second structure just near to the cephalic vein is the acromioclavicular artery. This acromioclavicular artery, after piercing the clavipectoral fascia, going to give four branches. One is the acromion branch, one is the clavicular branch, one is the pectoral branch, and one is the deltoid branch. The third structure which is going to pierce this clavipectoral fascia is the lateral pectoral nerve. So the lateral pectoral nerve, after piercing the clavipectoral fascia, is going to supply the pectoralis minor muscle as well as the pectoralis major muscle. Some lymphatics are also going to pierce the clavipectoral fascia, and these lymphatics are joining the axillary lymph node with the infraclavicular lymph nodes. So these are the structures piercing the clavipectoral fascia. And this is all about the pectoral region, which is most important part of the examination as far as the subjective exam is concerned or objective exam is concerned. Hope you understand well. Thanks for watching.